Hello, my name's Ethan. I'm going to be your nurse today. What's your name?
Kaylin Hafley,
And then your birthday?
August 4th, 2001.
Perfect. So we're going to verify that with our information and then proceed with the assessment. So Kaylin, today we're going to be doing a head-to-toe assessment. I'm going to ask you a few questions and we're going to assess those vitals, okay?
Okay.
If you have any questions throughout the procedure, feel free to ask me, okay?
Alright.
And then if at any point you feel uncomfortable, we can stop and move on, okay?
Okay.
Okay. So initially, we're going to look at, she is proportional to her height and weight. Those are things that we would have already assessed, however, we cannot at this point. She is in a pleasant mood, answering questions fully, well-groomed, very hygienic. And then, can you tell me your name once more?
Kaylin Hafley,
And then, what day is it?
March 3rd.
And then, where are we?
We're at SFCC Eldon campus.
Okay, and then who's the President of the United States?
Joe Biden.
Perfect. Okay, so she is alert and oriented times 4. So person, place, time, and situation. Okay, and then we're also going to ask you just some basic questions, okay, Kaylin?
Okay.
What's your exercise regimen?
I exercise every day. I walk, run, dance.
Okay, perfect. So some of those aerobic
Yep.
exercises.
Mhm.
Awesome. And then how about nutrition?
It's good.
Right?
It could be
Okay.
a little better,
We
but
can all get better. How about drug use? Any recreational, tobacco, or alcohol use?
no.
Okay, perfect. So those are things that we would note, as well as asking about family history of certain illnesses or disease processes. Okay, so Kaylin, we would assess your vitals at this point. We are doing those in person, so I will skip that portion of the video. And then we're going to move on to our head-to-toe assessment, okay? So at this point, because we are patient contact, I'm going to perform hand hygiene, provide privacy, and I will be explaining myself throughout the procedure. Okay, so at this point, it is up to my discretion whether or not I choose to wear gloves because we are in an intimate space with the patient. However, I will not be today. So looking at the hair initially, dirty blonde, we're going to note that color, resilient, it's thin, thin texture, it is thick, however, no pattern baldness, hair evenly distributed. And then it is free of any parasites or infections. So we're going to look for those things, as well as any lesions. And then I'm going to kind of touch around your face, okay, and your scalp. If you feel any tenderness, just let me know.
Okay.
Okay, any tenderness?
No.
Awesome. Okay, so normal cephalic. Her features are symmetrical, all aligned. Skin is pink, warm, dry, free of any lesions or wounds. And then we're going to move on to your eyebrows and eyes, okay?
Okay.
So eyebrows are match the hair color, evenly distributed, no wounds, lesions, or bad habits. So we're going to note that. Eyes, we're going to move down to looking at eyelashes. So again, evenly distributed, match the natural hair color. Okay, and then we're going to look at her conjunctiva. So I'm going to have you look up and I'm going to pull down. Okay, pink, moist, free of any wounds or lesions. We're also going to look at her campus and her surrounding skin around her eyes. Pink, warm, dry, free of any wounds or lesions. And discharge. At this point, I'm going to pull out my pen light. We're going to look at her iris, her pupil, and her sclera. Okay. Okay, so her sclera is white, free of any wounds or lesions. Her iris is blue, free of any wounds or lesions, smooth as well. And her pupils are smooth, black, and with defined borders. They are also equal to reactivity and light, so part of our PERLA, our pupils are equal around reactive to light and accommodation. At this point, I'm going to check your accommodation factor, okay?
Okay.
So I'm going to have you look at me and then look behind me. Okay, so we do see that constriction, and dilation. Okay, and then we're gonna do our 6 ocular movements, okay?
Okay.
I'm gonna have you follow the pin light. Perfect. So eyes are coordinated and movements are simultaneous. I'm gonna have you blink for me. Okay? Blinking is simultaneous as well, so we don't have any difference between the eyelids. Okay, and then also any pain, any irritation that you would like to talk about? Okay, perfect. Are you farsighted, nearsighted?
Farsighted.
Perfect. Do you wear corrective lenses for that?
Yep, I wear contacts and glasses.
Perfect. So then those are things that we would note. Okay, so then moving to your ears. At this point, I would check both ears. They are aligned to the outer canthus of the eye. And then they are pink, warm, and dry. And then using either an otoscope or just the room light, I would look inside. No seroma noted, no pus, no blood, or abnormal discharge. We would also check for tenderness on both ears. Any tenderness?
No.
Perfect. So we would note that, as well as the pinnae, flexibility, and firmness. So both pinnaes are firm but flexible, and they return to their natural position upon not touching. Okay, and then your ears are pierced?
Mm-hmm.
Perfect. Okay, so we would note that as well. Okay, so, and then we're gonna do a hair rolling test before we conclude our ear assessment. Okay, so occluding one ear at a time, tell me if you can hear me.
Mm-hmm.
Perfect. And then the other side?
Mm-hmm.
Perfect. So both ears, hearing is bilateral and equal. Okay, so then moving downward, we're gonna look at your nose. So I'm gonna be touching your face, okay?
Okay.
Upon inspection, skin is pink, warm, dry, free of any wounds or lesions. I'm gonna palpate your nose and maxilla for those frontal sinuses. Any pain?
No.
Perfect. So we would note that there is no pain upon palpation. I'm gonna look for any discharge, and that could include pus, blood, or any sinus discharge, just in layman terms, snot. Okay, and then we're also looking at septal deviation. You could either use a light or room light for this. I see no septal deviation, and it is midline. And then we're gonna look at patency. So I'm gonna include one nostril. I want you to blow. Try not to blow on my hand, but if it happens, it does. Okay, both nares are clear. Did you have any difficulty breathing?
No.
You have allergies?
Yes.
And is it usually frequent this time of the season?
Yeah.
Perfect. Okay, so we would note those things. Okay, moving down to the exterior mouth, we're going to look at her lips and the surrounding tissue. So, upon inspection, pink, warm, dry, and free of any wounds or lesions. The lips are dry as well and pink. Okay, and then using my pen light, I'm going to have her open her mouth. Okay. I'm going to examine those teeth and gums. No signs of gingivitis noted. No cracks or lesions, and no chips in those teeth. So we would note that the teeth are intact, white, gums are pink to reddish, and free of any wounds or lesions. Okay, and then I'm going to have you stick out your tongue for me, okay? Okay, so looking at the tongue, it's free of any wounds or lesions, pink, warm, bumpy, and moist. Okay? Okay, and then I'm gonna either at this point have her stick her tongue out and say ah, or use a tongue depressor. So have you say ah. Perfect. So her soft palate and uvula are both reactive. Her tongue is midline, and are your tonsils still in?
Mm-hmm.
Perfect. So her tonsils are intact and without discharge or tonsil stones present. Okay. So, have you had any pain in
No.
any of your teeth or anything? Okay,
No.
so we would note that as well. Okay, so then moving downward, we're going to go to your neck. So, I like to start on the anterior side since we're already working from the mouth down. I'm going to feel your trachea. Any pain?
No.
Okay, and I'm gonna make sure to push against it to see if it's mobile as well. It is. There was no pain noted, as she said. And then again, pink, warm, dry, and free of any wounds or lesions. And then moving to the posterior side, we're gonna look behind her ears and on the back side of her neck. We're gonna inspect her hair, again, free of any parasites. And then we're also looking at any wounds or lesions on the back side. Okay, and you're gonna feel my touch. I want you to tell if there's any pain, okay?
A little there.
Little bit?
Mhm.
Okay, so she has a little pain upon palpation of the cervical spine. We would note that and then possibly look into it more. Okay, so then here we're also going to look at lymph nodes. So I'm going to check her auricular, her post and pre-auricular, her occipital. We're going to look at submandibular, submental, her posterior cervical, anterior cervical, and deep cervical, and then her supraclavicular. Okay, and then we're also going to do a strength test. So I'm going to have you shrug those shoulders. Awesome. So strength bilateral and even. Push against one side and then the other. Awesome. Okay, so any pain? So we would note that there was no pain and strength is even. Okay, and then I'm going to have you do a couple exercises for me, okay? We're going to touch your ear to your shoulder on both sides. Any crepitus, any pain?
Mhm.
Okay. And then I'm going to have you tilt your head forward and back. And then I'm going to have you touch your chin to your shoulder on both sides. Awesome. Any pain?
No.
Okay, so we would note there's no pain. I didn't hear any crepitus. I can also palpate while she's doing it and feel for that crepitus as well. Okay, so at this point, we're also going to examine her carotids. I'm going to palpate one at a time. This will prevent any syncopal episodes due to a lack of blood flow. Okay, so 2+, even, regular, and nothing irregular noted. And they are smooth. We're also going to look at JVD. There is no jugular vein distension. We're going to look at that both sides, so bilaterally, no JVD noted. And then I'm also going to look at your brew, check for a presence of a brew. We're going to use our bell for that, okay? And hold it. Take a deep breath and hold it. Okay. So no root, no, it's noted. At this point, I would also use my diaphragm and check for her upper airway and respiratory tract to make sure there was no obstructions or anything noted. We could also listen for wheezes during this period or stridor. Okay. So moving down to the chest, we're going to inspect it. We're going to look for any wounds, lesions, pink, warm, dry. And then we're going to start with our lung sounds. So using the diaphragm. I'm going to have you take a deep breath and hold it every time I move. And then exhale. Perfect. And exhale. And exhale. Perfect. So lungs were equal bilaterally, no abnormal respiratory sounds noted, so no wheezes, that stridor wasn't noticed, or crackles. Then we could also look at our heart sounds. So we're going to look at our aortic, our pulmonic, our herbs, tricuspid, and mitral. And we're going to look at it with both the diaphragm and the bell. Okay, so nothing abnormal noted. I also noted her S1 and S2 chart sounds. There was not an S3 sound noted. That would have been a murmur or a gurgitation or a regurgitation from one of her valves, specifically the tricuspid valve. So we're also going to take her apical pulse for 1 full minute. And again, that would be right under that breast. Okay, so turning my patient around here, turning Kaylin around. We're also going to auscultate breath sounds on this posterior thoracic. Deep breath and exhale. 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 So again, perfect breath sounds, equal bilaterally, no abnormal respiratory sounds noted. And then clear to auscultation. And then we're gonna check out her spine. So from her cervix all the way down to those lumbar, okay? So tell me if there's any pain upon palpation.
A little there.
Okay. So at this point, we would inspect that further, that she does have pain in that lumbar section. However, we know that Kaylin does have scoliosis. Also no lordosis or kyphosis noted. So, and then we can see that with the S curvature of the spine. Okay, so again, her skin is free of any wounds, lesions, pink, warm, dry, and we're gonna feel for vocal sounds and make sure that it is present equally. Okay, so I'll have you say 99 as I work my way down.
99, 99, 99, 99.
Perfect. So they are equal throughout. And then we're going to look for lung excursion. So squeezing the lumbar thoracic area, I'm going to have you exhale. Perfect. Okay, so no atelectasis or paracentesis noted. Perfect. Okay, so rotating my patient back around, we will go to the upper extremities. So at this point, we're going to do range of motion. So I'm going to have you take it away from your body and back. So we're going to do adduction, abduction on that. Or abduction, adduction. My apologies. And then I'm going to have you circumduct. So raise it above your head and back down. Any pain? No crepitus noted. And then I'm going to have you do little circles and then big circles. Any pain? Perfect. No crepitus noted either. Okay, moving down to your elbow. I'm going to have you do flexion and extension, touch that shoulder and back. And then I'm going to have you hold a bowl of soup for me, supination, pronate it. Awesome. No pain? No crepitus noted. Moving to the wrist, rotate it for me. Any pain? There is slight crepitus noted. And then I'm going to have you extend it, flex it, and hyperextend it. Any pain? Perfect. No crepitus noted. And then inversion, eversion, any pain? Awesome. Okay. And then we're going to look at your nails. So the nails are firm, smooth texture, and then they are pink and free of any cracks or breaks. I'm going to check your capillary refill. It is less than 3 seconds, how we want it to be. And then I'm going to assess for skin turgor. Immediate. Perfect. So it is immediate. That shows signs of good hydration. Her skin is pink, warm, dry, and free of any wounds or lesions. And then hair is even bilaterally. Okay. And then I would do the same on this side. So I'm going to have you abduct it, and then adduct it, circumduct it, back, and then rotate it in small circles, and then big circles. Perfect. Any pain? Okay. Slight crepitus noted in the shoulder, And then again, flexion, extension, and then hold that bowl of soup, and then pronate it. Any pain? Perfect. Okay, moving to the hands. Again with the wrists. Any pain?
Yeah, a little.
Little pain, probably because we're over exercising it today. No crepitus noted. Again, flexion, extension, hyperextension. There is some crepitus noted, and I'm looking for those nonverbal cues of pain. So, did you have some pain doing that? Okay, so I would document that. Okay, so then again, we're going to check those capillary refills and skin turgor on this side. Okay, and then moving down to the abdomen, I'm going to have my patient walk with me to a flat surface and lay supine. Okay, so then having her expose her abdomen, I'm going to check initially, inspect for skin. So skin is pink, warm, dry, free of any wounds or lesions or discoloration. Contour is normal and proportional to her size. And then we're going to auscultate. So I'm going to auscultate in a systematic way using our quadrants. So starting on the right lower, then right upper, left upper, then left lower. And then while I'm here, I'm also going to check for a bruit. No bruit noted. Her bowel sounds are active and regular. Okay. How often do you have those bowel movements?
Every day.
Perfect. So that would be normal for Kaylin to have those bowel movements. Okay. And then I'm going to palpate. If you have any pain, let me know, okay? Any pain?
No.
Okay, no distension noted either. So, no pain, no distension. And then, have you ever had urinary retention?
No.
Any urinary problems?
No.
Burning? Any blood in the urine?
No.
Perfect. So, we're going to note that she's never had anything urinary, GI-wise. And then I would skip the percussion of the pubic symphysis. Okay. So then, at this point, I'm going to return your shirt and have you sit up for me. I'm going to check your costovertebral angle. I'm going to percuss that. Any pain?
No.
Awesome. Okay, so then looking at your legs and your lower extremities, I'm going to, skin is pink, warm, dry. Hair is short. I assume you shave.
Mm-hmm.
Perfect. Okay, so then it is free of any wounds or lesions. I'm going to check those pulses. So I'm going to find that popliteal, find that tibialis, posterior tibialis. And then at this point, I would have my patient remove her shoes and socks. However, I'm not going to have her remove her socks just for time purposes. I'm going to check that dorsalis pedis as well. They are a 2+, regular, bilaterally, and equal. Okay, so then at this point, I would check her capillary refill on her toes. I can also check skin turgor if I feel that there's a circulation issue. I would check for edema, looking at those 1+, 2+, 3, or 4, depending on millimeter depth. And then I would check her range of motion. So I'm gonna have you swing your leg out for me, and then back, and then out to the side for me. Perfect. And back. We're gonna do a strength test. So out, okay, in, perfect. I'm gonna have you push up and pull back. Awesome. So strength is good, and then her hip and knee range of motion is good without any crepitus or pain noted. I'm gonna have her evert her feet and invert her feet. Any pain? Slight crepitus noted. Rotate them for me. Again, some crepitus noted as well. And then I'm gonna do a light touch sensation on both your upper and lower extremities, okay? So using an object with a fine point or my fingers, I'm gonna have you tell me exactly where it is with your eyes closed.
Left arm. Right forearm. Left hand. Right shoulder. Right shin. Left thigh. Left shin. Right calf.
Awesome. Okay, so then at this point, I would have my patient stand up for me. And I'm gonna have you walk to the chair and back, okay? So gait is steady, no signs of pigeon toe or any type of unsteadiness. At this point, as my patient was walking, I noticed no precocities or varicosities, and then again, no edema. So sometimes that standing up, that positional change can affect that. Okay, do you have any questions?
I do not.
Awesome. So at this point, I would provide my hand hygiene, make sure my patient is comfortable and safe, provide that call light, put up the side rails if need be, lower the bed, lock the bed or wheelchair, and then provide privacy. Okay.